As a medical professional, it is important to remember that what you see on paper doesn't necessarily mean what you will see in real life. As a respiratory therapist, have you ever sat down, gotten a report, looked at the patient's chart, looked at their sex, their age, their name, prepared to go into the patient's room, and when you walk in, it's completely different than what you expected? You look at the patient's armband to make sure that it's the right patient. You have them do their identifiers, and it is in fact the right patient, and they want you to refer to them as sir. As the world changes, people are trying to figure out who they are, who they want to be, and how they want to identify. It is important that gender-based medicine goes along with that. Sex and gender are normally used interchangeably, but in today's society, these two words are becoming more distinct. Sex refers to the biological difference between males and females. Gender refers to the role a male or female play in society. It is more common to have a female patient that identifies as a male, meaning her genetic makeup is female, but that she identifies as a male. This is very important to remember as we're treating these patients. It's important to have the proper education on treating them biologically and also treating their behavioral differences. Males and females are going to behave in a different state. Biologically, their bodies are going to react differently to certain medications, and we need to be aware of that. Behavioral wise, they're going to act differently as well. So you will have this patient that is female that's going to that her body's going to react a little differently to the medications we are giving, but behavioral wise, she looks like a man. We have to remember that if they want to be called sir, we need to be understanding with that and refer to them as sir. But we also need to remember in their chart, in their history, it's going to refer to a female. This is where education comes in. There's a lot of lack of education in gender-based prevention right now. It is important as a manager to help your staff understand the differences and be more understanding. Identifying new approaches to gender-based care is very important. A lot of medical professionals are realizing that there is no difference between treating males and females with certain medications. This will make it easier when we have patients who are identifying as a different gender. Everybody's going to be treated the same, and the benefit for patients and staff is less mistakes will happen. Education is key in preventing these mistakes. Now remember, mistakes can happen. During medical emergencies, it is very important to remember that when you're treating a patient who is identifying of a different sex, that you're still treating their genetic makeup, which can get very confusing and mistakes can happen. It can also make the patient and staff very uncomfortable when they keep referring to the patient as their sex in their chart versus how they're identifying. Patients will be more willing to treatment if you get on their level and you explain things and you are willing to accept who they want to be. We need to change the way we train people and the way we educate. The world is changing and so must medicine. We're given many options these days, and it is hard to identify when a patient just walks in. You don't just assume.